healthy is an everyday challenge, but for cancer patients, it's especially difficult because they're often battling nausea and loss of appetite and other side effects that make eating more complicated.
Now, one dietitian at Cancer Treatment Centers of America in Newnan knows the challenges patients face because he's been there. The Fox Medical Team's Beth Galvin is here now with the story.
And Sine and Tom talk about a life-changing experience, because it's one thing to guide patients struggling with serious health problems like cancer. It's another to actually be the patient, as Nathan Schober learned last winter.
She got steroids last week with her chemo.
Nathan Schober believes in the power of food. And as a lead clinical dietitian at Cancer Treatment Centers of America in Newnan, it's his job to help patients who are struggling with the side effects of treatment.
Chemotherapy, radiation, either they can't chew, they can't swallow.
Schober works in the hospital's ICU right now with patients on IV nutrition. But he's seen over the years how hard it is for cancer patients to keep up their strength when nausea and constipation and other complications make it difficult to eat.
Taste changes is a big one. Foods don't taste right, water tastes metallic to them.
In January, Schober started having some odd symptoms of his own. He developed a rash on his leg, then a lump on his neck, and
I was having some fevers that I was just writing off as being sick in the wintertime. I wish I had listened to my body a little bit earlier. I knew something wasn't quite right.
And when he finally went to the doctor, he ended up in the ER, diagnosed out of the blue at 30 with Hodgkin's lymphoma.
The next week, I started chemotherapy.
Overnight, the cancer dietitian became the cancer patient.
I ended up having pretty bad nausea, a mouth infection, troubles with bowel function and all those things.
But he tried to pace his eating to keep up his strength.
I had a good week and a bad week. So for me, I would struggle through one week, and then the next week I would eat very good, all the things that I should, enjoy my food while I could. No troubles chewing, swallowing.
That hard-earned experience now helps him connect with patients like 53-year-old mother of two, Anita Williams, who was diagnosed with breast cancer in 2015.
I stopped with a lot of meat. I stepped away from the beef and the pork.
Williams is now cancer-free, and she feels fortunate she never lost her appetite during treatment. But changing her diet helped her get through it.
It gets you not focused on feeling sorry for yourself, but it gets you focused on getting better.
Nathan Schober says his experience helped him slow down and really listen to what his patients are telling him.
I'm not trying to get to the end goal quite so quickly, just meeting the patient where they are and moving forward.
He learned to skip big meals and instead eat small amounts throughout the day, concentrating on any food that's easy to tolerate. And later this month, Nathan Schober will undergo more scans to see if his treatment worked. But he's hopeful and grateful for what this experience has taught him.
My big thing has been to appreciate every day and not take any of them for granted. So be as happy as you can every day as a choice.
That's a good philosophy, a choice to be happy. And Nathan says he doesn't really talk a whole lot about his cancer experience, especially since he's just on the tail end of it. But when he does see a patient who seems to be struggling, he shares his diagnosis and his story, and he thinks that that helps, Tom and Sine, and it's got to help to have somebody else who's walked in your shoes and knows exactly what you're dealing with because he's been there.
Yeah, most definitely.
And being relatable in that case is so important.
Absolutely.
Thank you, Beth.